Welcome back to the Doc and Diana Show. Today, we've got a special tour that we're going to do. It's Charles Dickens style of Revolution Health and Wellness Clinic. So we're going to talk about sort of, not really ghosts, but we're going to talk about ghosts of Revolution past.
Where we come from.
The ghosts of Revolution current, present,
Yes.
where we are, and the hopeful ghosts of Revolution future. So, let's go. So here in Revolution, we have a chiropractor. Her name is Dr. Crystal Lewis. She is an upper cervical chiropractor, meaning she really only focuses on the first two cervical vertebrae, the atlas and the axis. And we've seen some really cool benefits to what she does just in the chiropractic realm. Now, she is also an RN, a registered nurse, and she is working toward becoming a nurse practitioner. She sees patients both chiropractic as well as functional integrative medicine. She obviously doesn't prescribe medications because in Oklahoma she cannot, but there's a lot of stuff that she brings to the table and is really cool. So this is her exam room and her chiropractic stuff. Now again, she will do stuff in other rooms and she kind of runs the IV program. She is an IV certified chiropractor, so she can do IV nutritional therapies and things like that. So brings incredible resources to the clinic, does a fantastic job, and our patients just absolutely love her. So this is our IV nutritional therapy room, or one of the places where we do our IV nutritional therapy. Really cool resource. There's some really great things that we can do through IV nutritional therapy. With some of what Diana does, she deals with, of course we all deal with nutrition, but in her coaching, she kind of discovers where patients have some nutritional deficiencies. We figure some of that out through our lab testing, and sometimes, and really what Diana is really good at is dialing in on, okay, you're eating the way you should be eating, but for some reason you're not absorbing these nutrients. And so IV therapy can bypass gastrointestinal health and we can get the nutrients in that way. Plus, when you look at vitamin C, when you take vitamin C as a supplement, you can take 250 milligrams of vitamin C and your blood levels will go up a little bit. You can take 2,500 milligrams of vitamin C and your blood levels will go up a little more. But we can get a substantial increase in your serum levels of vitamin C by giving it intravenous. And vitamin C has some tremendous benefits when you can get good levels in your bloodstream. There's some really good data going over the years. In fact, there was a paper published 1940s. I'll put a reference in the video for you, where I think it was Dr. Klenner resolved polio in 60 out of 60 patients. 100% of his patients in the 1940s, he resolved prolotherapy with intramuscular vitamin C. And again, I'll put a reference for the paper in the show notes. So there's some really cool things that we can do with IV nutritional therapy. There's some chelation that we can do. The TACT-1 trial showed that it reduced cardiovascular disease in type 2 diabetes, or in diabetic patients, I should say. So really cool stuff that we can do with the IV nutritional therapy. And certainly we have, Diana and I have little thumbtacks stuck in our wall at home.
Yes.
Over our bed. We'll have to show that sometime.
They're just there permanently waiting for our bags.
When we get sick, we're run down, we make a bag and we're taking it at home and hanging it up on the little thumbtack, and we get IV infusions. We do that in our house. Our kids have gotten them. Our staff gets them. When we get sick, we get them. It is kind of our go-to. So we wanted a place that was kind of serene and comfortable, and you get the recliners, because sometimes for some of the therapies you can be in here for a few hours. So
yeah, take a nap.
Yep, exactly.
Take a nap.
So got the recliner, and my feet don't reach.
Mine don't either.
But it's fine. It's nice and comfortable. So Diana, if you want to go ahead and finish out the tour, I'll be right here.
Oh, that's fabulous. Well, guys, also IV therapy helps a lot with clients trying to up their hydration. Shh, just go to sleep. Hydration, it's great for acute reasons if you do get sick, but it's also great for prevention. So a lot of the time, whenever we know that cold and flu season is coming up, it's just part of our battle rhythm and our routine is to do it. If we know we're going to be traveling a lot, getting on airplanes, close contact with a lot of people, we'll go ahead and get an IV bag in. One of my favorite parts about it is the glutathione push that I get at the end. A super high-powered antioxidant. Once I get my IV bag, I tell my clients the best way to describe it is I will ride that antioxidant high for like 3 days.
Yeah.
I have this immense amount of energy, but it's not caffeine energy. It's focused. It's productive. I feel really, really good. So ask about the glutathione push as well. Anything else we can think of?
Not for now,
Come and join us.
but more to follow.
Take a nap.
This is one of my favorite rooms. Not so much the room, but like what's in it. We've spent a lot of time accumulating some really cool testing equipment. This testing equipment really centered on cardiovascular, but also on gastrointestinal issues. So not your traditional, I need to get a heart cath to see if I have blockage in my arteries. We're looking at what is the health of the artery itself. So we have things like the cardiovascular profiler that will tell us about the elasticity of the artery. And I can go into a whole dissertation about why that's important, but it's a really, really cool test. And I think everyone should have that once a year and see how we're doing there. We also have the Heidelberg capsule. Heidelberg capsule is a pH monitor for your stomach. So here we can actually, when patients come in with reflux, poor stomach health, a lot of allergies, immune impairment, having food issues, we can actually determine how is your pH in your stomach based on not eating at all. And then when you eat, how does your stomach respond to that by producing acid? So we can look at hyperchlorhydria, too much stomach acid, which a lot of people think that they have reflux, and so they have too much stomach acid. It's not really the case. 80% of the time, it's actually hypochlorhydria, not enough stomach acid. And in many cases, we can give stomach acid, and it will actually circumvent the need for the acid-lowering medications. And there's a lot of potential problems associated with those medications, but sometimes they're needed. So we can actually assess that here with this machine. We're one of, I think, one of 2 clinics in Oklahoma that have one of these devices. We also have several ways of assessing blood pressure, and the cool thing is we can actually measure central blood pressure as opposed to just going to your doctor's office, put the blood pressure cuff on, listen with a stethoscope, and tell you what your blood pressure is. What's called peripheral or brachial blood pressure, we can tell you what your blood pressure is at the heart and at the aorta, which is a much better indicator of your risk of having cardiovascular disease. Very, very cool stuff that's taken us a long time to be able to afford and pay for these machines. So we got some great stuff. So this is our kind of our nurse testing room where we run these tests.
Okay guys, so this is my absolute favorite room ever, as Doc is laughing at me behind the camera. This is our lab room. So basically we've got 2 options. When we have our phlebotomist come in and pull the labs for us, if you're a good patient, you get to sit in the chair and you get to sit upright. But if you have some tendencies to pass out, or you have a history with our phlebotomist that you've passed out on her, you get the white chair. So this is where I get to give blood.
One of our exam rooms, it's just an exam room. One of the things that when I was at Warren Clinic, is a large clinic I worked at in Tulsa, Oklahoma, the exam rooms were 8.5 by 10 feet. And that included the sink and all of those kinds of things. I would do a small procedure and have to move half the stuff out into the hallway. So I wanted exam rooms with plenty of space. So we can have a patient with a family member or a couple of family members, and we can put their labs up on the television screen. We can get wheelchairs in here. It's nice having room and being able to do what we need to do. I can move the table into the middle of the room if we needed to do a procedure in here. So I like having that flexibility. And we've got some pretty comfortable chairs, and And it's just an exam room, but wanted to show you what that looks like. This is our procedure room. When we got this building, it was actually built for a couple of physicians who were pediatricians, and they never took the building. But this room was their x-ray room. So this room is lead lined, and it's got some pretty cool features, and we thought, it's a little bit bigger than our typical exam room, and thought, this would be great for our procedures. Of course we do prolotherapy, and sometimes we'll do that procedure under sedation. So we'll start an IV and give medications to kind of put someone to sleep, or at least make it where they don't really remember, and maybe they're a little bit goofy. So we can do that procedure where they walk out not having had a bad experience with a potentially uncomfortable procedure. So we do all of that here when we're on sedation and they're hooked up to the monitor, and we have full defibrillator and cardiovascular resuscitation stuff. And this is where we do most of our prolotherapy and a lot of our procedures.
This is the office that houses Optimally You. So in this office, this is where the rubber meets the road. Patients will go in and get lab reviews, they'll get some advice and some direction from their providers. Some lifestyle changes are part of that most of the time. So then they can come and see me, and we can take some time looking at what their current situation is, kind of get some goals established as to what they want to accomplish, and then we make some realistic co-created plans that actually lay out the steps for them to be successful and to have something sustainable once they reach that goal. So if you're interested in some lifestyle management and some changes, come see me at Optimally You. This is our all things women room. So we do aesthetics in here. We have our fillers, Botox injections, and then we have this guy. So Skin Pen. Skin Pen is an amazing microneedling little device here that is fantastic for things like fine lines, wrinkles, collagen production. So it just kind of helps with that fullness in the face. But it's also terrific for scarring as well as stretch marks. So if you've got acne scarring, if you have skin around the knees that starts to bag, we can take care of that as well. Guys, this can be used pretty much just about anywhere on the body. So if you've got a scar that's bothering you or stretch marks, this is your answer. Very little downtime and amazing results. Now, we also have another wand in this room. This wand is our Vivive. So Vivive treatments are really, really good for things like stress urinary incontinence. Stress urinary incontinence, if you have a problem with leaking, if you have a pee-pee problem, if you are jumping, sneezing, coughing, laughing, if your workouts are becoming a little more avoidable because of it, jumping jacks, jump rope, playing with your kids jumping on the trampoline, this is your answer. One treatment with the Vivive will take care of your stress urinary incontinence. But there's also an added benefit. And this added benefit, because of this treatment, is going to help you with more frequent and more intense big O's.